Welcome back to the Bumper Breakfast this morning. It's our health segment, and this morning we're talking about medical therapy, and we have Dr. Ogunleye Toluwalokpe in the studio with us. But of course, before we introduce our guest, I must tell you that the beautiful Miriam, is here with me this morning. She's been behind the scenes, don't worry. It wasn't that she wasn't here. She's just been here admiring me from afar. Now she gets to admire me from physical.
Yes,
she wants
sir.
to remove my clothes, but I'm not give her.
But it won't size me go back to me.
It will have sized you,
But
when I stand up, you see that he sized you. It's just that I can't give you.
I will follow
can't
you
give
to your house this morning. I will go take it.
I'll not go.
You are not. You will go home. Or you have to go home.
I'll not go home.
Tell me you have to.
I'll go home very late at night so
You
that
will-
you not follow me.
I will wait till night.
Alaji
now.
will call you.
Alaji will not call you. I will tell him that I want to collect something from Penny. He knows you too well. Good morning to me. Good morning,
How are you
Nigeria.
doing today?
Very well, thank you.
Very
You're
well,
looking
right?
Pretty. And I will always remind you that you're always sitting pretty in things like this, wears like this. In fact, this one that you are wearing,
now I'm feeling like
dread this morning.
I'm feeling like
Just give me
I'm
everything,
feeling
all the
vibes and
patterns. I want
vibes.
it.
I'm feeling vibes and vibes.
You know, thank you, my. Good morning.
I'm just here having fun with you this morning. Let's introduce our guest this morning. He's a regenerative medicine expert. We're talking about Dr. Toluwalokpe Ogunleye. Good morning. How are you doing, Tolu?
I'm fine, good morning.
You're dark. Almost all the Tolus I know are dark. Like they're really quite black.
Black
And then
skin
your
boy.
hair is like really, really
I
blacker
love
than your
that.
skin.
Black skin
Black
boys.
skin boy.
Black skin boys. There's no song for you people. You people should stop feeling cool. Good to have you here this morning.
Thank you so much.
What exactly is regenerative medicine?
Okay, because of our time, I will just have to be very brief. Now, you know that these days when you're sick, basically when you have some diseases or when people break down with some issues like stroke, like cardiovascular issues, like autism and all the likes, you know, when you go to the hospital, the only thing they do is just to take medications to take away the symptoms. But thank God that science is advancing. Everything in the world is advancing, and we are able to. The regenerative medicine is more or less like taking not only the symptoms but getting to the root of the issue, which is formed from the cellular point of the disease. You know, when we were in secondary school, biology class to be precise, they taught us that cell is the basic unit of life, and human being is classified in this category from the molecules to the cells, from the cells to the tissue, from the tissue to the organ, from the organ to the system. So most often, some of these diseases, they go down from the molecular point of view, from the down, while some from the cellular point of view. That's why some people with arthritis, some people with other things, some people tell you my tissue. It's not only tissue, it is down way back to the molecules. And with medicine can only take off the system or the organ, but there's something that is taking care of the disease down way back to the molecule or to the cell, which is regenerative medicine. So regenerative medicine is more or less looking into the disease from the molecular point of view, repairing the tissue. It's from the word regenerative. So a tissue or a cell that has been damaged or that has been destroyed, regenerative medicine is giving the platform or the opportunity to repair those things. And you know, there's something about medicine that is also applicable to God. Though I'm a scientist and I also need to give that fact to God. God has really created a system for human being where we have the ability to repair some things in ourselves without the help of drugs. But you know, due to some things that we are unable to engineer those things to that point, and that is where regenerative medicine as a field, though it's a new field in medical science, which started around 1990, but it's becoming prominent, not only all over the world, but even in Nigeria here, we've been able to do a lot of wonders with regenerative medicine in Nigeria.
Well, okay, so with this particular ones, I really want to find out how important it is for people to begin to expose themselves to this kind of medical treatment.
Okay, this is it. The message this morning is like a message of hope. Now, majority of the disease that regenerative medicine tackles are diseases that, at the moment, medical science or clinical science will tell you they are untreatable or incurable.
Okay.
Let me use sickle cell for example. We know how terrible it is. So we just started a movement recently where we're trying to kick off sickle cell disease from Nigeria between now and 2030. because sickle cell disease is is an African thing. It's more or less like a Nigerian thing. Nigeria is the headquarters of sickle cell disease in the whole world. So now looking at sickle cell, looking at some disease like stroke, no matter if a patient should have a stroke and it's untreatable early, even though with the help of physiotherapy and some other clinical stuff, the factors or the physical appearance that the person has stroke will still be there. It won't take it off totally. Now, some disease too, like autism, some children that are autistic, some disease like cerebral palsy, some disease like spinal cord injury, some disease like multiple sclerosis, and some other core disease. These are diseases that on a normal day in the clinical studies or clinical medicine, they cannot be treated. Now, with the help of regenerative medicine, we are able to not only take off the symptoms, but possibly able to restart the system, restart the cells back to the normal level. Now, now under this regenerative medicine, the reason why it's important, we have different forms of regenerative medicine. We have organ repair. Organ transplant, where you hear people talk about kidney transplant and all the likes.
So that's part of the regenerative.
It's an aspect of regenerative medicine.
Okay.
It's a field. It's a part of it's a field in regenerative medicine.
Okay.
Organ. Now people. Before now we don't used to hear things like kidney transplant, but now we're doing a lot of transplants. Kidney transplant, so many. By very soon, a research is going on that where they're able to even transplant the head. So yeah, a lot of things is happening.
At this point, I'm just like this.
People
want to transplant it.
A lot of things.
Seriously,
a lot of things is happening. A lot of things is happening.
How will you save? They say the head is gone, the body is gone. Life is gone.
No, the issue is that, and the reason why we are trying to inform people, we don't want Nigeria to be backstage. We are behind the scene in Nigeria.
Behind the scene, clarify.
Okay.
Which means
the
medical.
No, what I'm trying to say behind the scene. Okay, I'm trying to say that the main scene is happening in countries like Europe and all the likes. They are already in 2070. So we are
in medicals.
Yeah,
in medicine.
Let's say in medicine, but that's not only in medicine.
Technology.
In technology aspects, but at least in medicine we're trying to at least.
Yeah, we're trying.
We're trying. That
you say we are behind.
But then we have one of the best doctors, and
they don't work here.
The best doctor. No, we export now. We help them. We help them prepare them, and they come by us. So, but we are trying to say down that now what they're doing in Asia, what they're doing in Europe, we are beginning to do some of them. Now we do sickle cell transplant in Nigeria.
Sickle cell transplant.
Yeah, we do sickle cell. So these are things that.
Hold on.
Okay.
There's a possibility that they can transplant cells.
We change. Not okay. Don't let me help you. Don't use that.
Because I have a question.
We change genotype from SS to A or AS
in Nigeria.
In Nigeria. That's
how?
It. Oh, that's.
Hold on.
That's
is it inside?
Not only that, even
you do it when the mother is still pregnant with the child, or when the child is
even
grown.
People with spinal cord injury, with the help of stem cell, they can be able to walk back.
Oh.
People that have
in Nigeria,
that's what I'm trying to tell you, that we are trying our best.
Oh, there's a hospital where it is being in Nigeria.
So we no longer need to travel to India.
People, let me tell you this. Nigeria is now becoming like a medical point of medical tourism. I have majority of our patients as we speak, because it's kind of still expensive. So majority of our patients as we speak, they are 75 of them.
75% of them.
Let me say 85% of them are in Europe and America. They come all the way from America to Nigeria.
Nigerians,
and that was why I made the statement earlier.
Do you mean
that we have some of the best doctors? I read something there before yesterday about
Nigerians and also blacks, that though they are not necessarily Nigerians.
Okay.
I was in Ghana some time ago to see a patient. We have patients coming all the way from Ghana, coming all the way from other African countries to Nigeria. We have
for medical tourism.
For majorly for stem cell therapy.
And is it the same thing as neuro whatever?
Not really necessarily the same, but there are some now in stem cell treatment. We also tackle some neurological disorders.
Because I read about it.
Stroke is a neurological disorder.
Okay.
Because it has to do with the brain, the neuron, central nervous system. We have stroke, we have autism, we have cerebral palsy, we have.
So there is a possibility that you can treat cerebral palsy.
Yeah, definitely.
How expensive?
Okay, now it's expensive actually, because it's Now, the punchline with this is the fact that what we're even making use of is the placenta, the umbilical cord, the placenta that a lot of people take attention to. But science have been able to make us understand that this disease, this placenta can be able to cure over 80 diseases. Over 80 diseases. We can be able to cure so many diseases with this placenta, placenta that people bury. The blood in the placenta. We have now, we call something stem cell. What are stem cells? Stem cells are cells in the body, but they have the ability to repair, to renew, and to rejuvenate. And they also have the ability to take a shape. Now, let's assume a stem cell is being put into the blood system or like into the bone marrow. It takes the form of red blood cell and white blood cell. So it takes a form. So they are like egg, and like egg. You know, mother hen. When the mother hen lay eggs, either become the male, which is the cock, or either becomes the female, who is like the hen. So that's that's how stem cell is.
So let me ask a question here, because we're getting really technical, and I think people would really want to know where the stem cells come from.
Okay, now this is it.
You know, we're very superstitious as a people. When they say you want to do something therapy, something, you're saying stem cell, people are thinking, are you taking the stem from the tree, or are you taking it from human animals, or they say that it is 5G something. I hope it's not a technology.
No, this is
and I hope that it is not a cell that was created with a neutron or something in chemistry and physics and I put into the human body, because then people assume that it's not natural.
Not at all. Stem cells are natural. They are cells in our body. Before now, I know people used to hear bone marrow transplants.
Yes.
Is also under regenerative medicine.
Okay.
But because the way they collect now in the bone marrow, there's a particular stem cell inside the bone marrow. That's what I'm trying to say. God is good. You know, majority of the things we need are already in our body. Now, that's why you see that when you have a wound, naturally, the wound has the ability to heal back, because that is how it is.
So it regenerates the skin and all that.
Even science makes us understand that when a mother is pregnant and the mother has issues with some organs, if it's not a terrible issue, the baby has the ability to send stem cells to those organs and to repair it. And that's why now the richest site for stem cell is the placenta. The umbilical cord blood, the umbilical cord tissue. Now, that's the baby placenta, like it's the richest. It has the ability.
So people can sell their placenta?
We don't sell. No, we are not asking people to sell.
No, I'm just asking you, because
this
one that you are saying that is the
richest.
richest.
Now this is it. It's not sell.
They should stop burying it.
Yeah, we are most times we encourage people to store. We now bank. We represent a UK facility that banks. So
banks placenta.
Banks placenta. You can bank it for over 30 years.
Wow. And it won't smell.
Usually they tell you.
So it is not. They don't. Okay, this is it. They don't carry that the way it looks dirty, the way it looks. Horrible. Sorry to say.
They say it even melts into water. That it can degenerate into liquid.
Yeah. So this is it.
Because I remember my doctor said to me that it could degenerate into liquid if you flush it.
They process it. So it is not that, though the placenta, we remove a particular sac and there are stem cells in it. Now we have two types of stem cells in the placenta, the umbilical cord and the cord blood. We have the hematopoietic stem cell, and we also have what we call mesenchymal stem cell.
Don't worry, we are not medical people.
We don't even want who has blood cancer.
Yeah, leukemia, for a particular form of leukemia. Now stem cell is looking at the point of using that hematopoietic stem cell, which is blood related.
Inside the placenta.
Yeah, but in this kind of case, because it's blood, it needs a match.
Okay.
It needs a match.
Okay. So maybe from the genotype must be the same.
Not necessarily the genotype, but we call something HLA, human leukocyte antigen.
Okay.
It must be compatible.
Please, I hope the person will be needing kind of blood transfusion.
No.
Because you mentioned the stem cell.
Now this is it. Now for sickle cell. Let me create a scenario for sickle cell.
I think I'm getting this point.
Let me create a scenario for sickle cell.
Okay.
Yeah.
Now, a father or a mother, probably they are ignorant and they give birth to a child with sickle cell. Unfortunately for them, again, they want to give birth and they are aware that now the moment there are a lot of tests that we can do as early as 10 weeks, we can know the genotype of the baby.
Okay.
Even we're getting to a point where we can change the genotype inside the womb. We call that intrauterine transplant, but we've not started that in Nigeria. Science is still going further. But now we're able to discover that, the baby now that inside the womb is the baby is not sickle cell, it's probably AS or A. Instantly, we'll do something called HLA compatibility test. Why the baby is still in the womb?
Okay.
So after doing the compatibility test with the child that is sickle cell, maybe and
That's-
they realize that they are compatible.
Yes.
Either it is haplocompatibility, which is half, or full compatibility, and maybe the baby is A or AS. Glory be to God. What we do instantly, immediately the baby is being delivered, we have our staffs and our teams there, anywhere in Nigeria or anywhere. They collect that blood. There's a blood inside the cord. They collect that blood with a particular specialized bag, just like a blood bag. And after collecting it, the stem cell, that is the hematopoietic stem cell, we now extract it. It's not that same particular blood again. We now extract it.
The way they extract the platelets?
Yeah, something like that.
Okay.
So we now extract it. After extracting it, it is now that stem cell, that hematopoietic stem cell, that will now transfuse
Into the other child.
After we might have destroyed the child's
Sickle
blood cell.
Okay.
We are going to destroy the blood cell. The blood cell is comprised of the white blood cell, the red blood cell. So
Okay.
we destroy totally. So the child will be
So
running over that point.
that can happen between like 7 days
No.
before the naming, or when?
No, we are not they've given back to the baby. We are not working with the baby again. We've collected what we need from the baby.
Okay.
So the baby. But
It's
we are
from the baby's sac
It's a
now.
bit-
It's
so
from the
we-
baby's
so we are
placenta.
now dealing with the first child that is sickle, that has sickle cell, the sickle cell. So and that process most times takes months because we have to first of all degenerate the normal cell in the body.
Because we have
Before
so many
you now
people,
infuse.
fight
Yeah.
that.
You know what? A lot of
They will now
people-
infuse. They will now begin to
A lot
so-
of people will want to reach out to you, Dr. Tolu, and say that they want to find out who you are, will come to your hospital and all that. How do they do that?
They can visit us at we have a website, so you
Okay.
can just go to www.bentoluinhealth.com.
So you can spell that.
Okay, BENTOLUENE
.com.
health, like
Health,
yeah,
okay.
.com.
Okay.
Bentoluinhealth.com.
So BENTOLUENE health.com.
health.com. And you can also have a contact.
Okay.
081 01 03 0917.
Again.
081 01 03 0917.
Help for people who have health related challenges as we speak. Dr. Tolu Walokpe Ogunleye has been here with us this morning talking about regenerative medicine, and obviously so many people have those issues they would like to deal with. So the number again is 081
Yeah, 01
01
03
03
09
09
17.
17. Thank you so much for being here with us this
Thank
morning.
you.
There's a lot to come on the bumper breakfast, and of course this time when Mimo Adebi joins us, we're talking about negative emotion, and I'm just going to be like this because Miriam and Wemimo will be recognizing it by themselves.